Fundamentals in radiology, X-rays was discovered by Roentgen. The active ingredient of X-ray film is silver bromide. X-rays are modified electrons, increased energy linear acceleration used in X-ray. X-rays are produced when electron beam strikes the anode, which is provided by linear accelerator electron. Ion which scatters X-ray most is lead, and maximum scattering in X-ray plate occurs in carbon. What is needed for proper radiographic image of in a heavy bony built person? TKVP, and that is increased KVP. Contrast in X-ray is dependent KVP. Photoelectric effect can be best described as an interaction between a low energy incident photon and the inner shell electron. Photon transferring some of its energy to electron is Compton effect. Grid is a device for reducing scattered radiation. CAT was invented by Hounsfield. Hounsfield units depend on attenuation coefficient. In computed tomography, the attenuation value are measured in Hounsfield unit HU, and attenuation value of 0 HV corresponds to water. HU is measure of uh, Hounsfield unit that is used in computed tomography. Slice of tissue X-rays is tomography. High resolution CT of the lung is a specialized CT technique for greater detail of lung parenchyma, and it utilizes bone algorithm for image reconstruction. High resolution computed tomography of the chest is the ideal modality for evaluating interstitial lung disease. Which one of the following imaging techniques give maximum radiation exposure to the patient? CT scan. Radiation hazard is absent in MRI and Doppler USG. Calcification is best detected by CT scan. Regarding CT scan, all are true except 50% reduction in KVP reduces 50% radiation doses. False. What is true is decrease in milliampere decrease radiation dose exposure significantly in pediatric chest. Quality of the radiation generated depends upon voltage, and radiation dose exposure is directly related to the time of exposure. Wall of the CT scanner room are coated with lead. Which of the following technique uses piezoelectric effect, that is ultrasonography? Ultrasound frequency used for diagnostic purposes in obstetrics are 1 to 20 millihertz, and frequency of sound waves used in USG is more than 20,000 hertz. USG wave travel in human body at the rate of 1500 meter per second. Ultrasonography transducer contain lead zirconate. The ultrasonic sound waves employed in ultrasound machine for medical sonography have the frequency of 2 to 20 millihertz, which is not ecogenic while doing ultrasonography. Bile. So what is ecogenic gas? Bone and gallstones. Acoustic shadow is produced by the following except fat. So acoustic shadow is produced by bone, calculus, and gas. The intensity of color in Doppler is determined by velocity of flow. Contrast used in USG is Sonavist. Time sector scanning of neonates is preferred because of the following reason. Most practical reason is open fontanelles. In which of the following form of imaging harmonic imaging is related? Sonography. NMR based in the principle of proton beam is more appropriate than magnetic field. In MRI, the field used is 1.1 Tesla. T1 and T2 images are a feature of which diagnostic test? MRI. On a MRI scan on increased weighted images, all appear hypointensive except chronic hemorrhage, which looks on MRI fat advantage of MRI is best to visualize vascular structure and it can be used in multiple planes. Which of the following is not true about MRI? MRI is better for calcified lesion is false. MRI is useful in locating small lesions and CT is better than MRI in bone lesions. An absolute contraindication of MRI is pacemaker. Absolute contraindication of MRI is pacemaker and aneurysmal clip. Patient with a metallic foreign body in eye, which investigation is not done? MRI is not done. True about uh, MMR all except not helpful in breast implant. So what is true is no radiation exposure and contraindicated in cardiac pacemaker. That is for MRI. All of them use non-ionizing radiation except radiography. Which one is non-ionizing radiation? MRI. Time of flight technique is employed in MR imaging. Most radiodense substances bone. MRI rooms are shielded completely by a continuous sheet or wire mesh of copper or aluminum to shield the imager from external electromagnetic radiation, etc. It is called Faraday cage. The EEG cabins should be completely shielded by a continuous sheet of wire mesh of copper to avoid the picking of noise from external electromagnetic disturbances. Such a shielding is called as Faraday cage. PACS in medical imaging stands for Picture Archiving and Communication System. Which of the following statement about contrast in radiography is true? Ionic monomers have 3 iodine atoms per 2 particle in solution. Contrast used in CT is iodine. Contrast used for MRI is gadolinium. Radio contrast is contraindicated in all except obesity. Obesity is not a contraindication for radio contrast. What are the contraindications? Renal failure, patient on metformin, and dehydration. Which of the following contrast agent is preferred in a patient with decreased renal function to avoid contrast nephropathy? Low osmolar contrast. So contrast media of choice for myelogram is eohexol. Contrast material used in the diagnosis of esophageal atresia is dianosel. Non-ionic dye is iohexol. Non-iodine containing contrast is GDDTPA. Allergic reaction to radiological contrast agent are anaphylactic reactions. All of the following are true about iodinated intravascular contrast media except that they are used in magnetic resonance imaging. So what is true about iodinated intravascular contrast media? They are used in digital subtraction angiography. They are radiopaque, they can cause anaphylactic reaction and they are excreted mainly by the kidneys. IV contrast is not used in myelography. Now respiratory system for chest x-ray best view is PA view. Decubitus view is useful in diagnosis pleural effusion and pleural effusion with dependent hemothorax. Minimal pleural effusion is best detected by lateral x-ray view. What minimal amount of pleural fluid is seen on chest radiograph? None of these is much appropriate, but if not given, then 50 ml is appropriate. Right anterior oblique view of chest x-ray. True is cassette near right shoulder and left atrial enlargement can be diagnosed. Which view is taken for aortic window? Left LAO. Apex of lung is best assessed by lordotic view. The lordotic view is valuable in confirming the presence of lesion in the lung apex and also in the lingular segment. Right lung is seen to best advantage on the following view: right posterior oblique and left anterior oblique. Best view to diagnose pneumothorax is PA view in full expiration. X-ray film should be taken in closed pneumothorax during deep expiration. Normal hilar shadow in X-ray chest is produced by all except lower lobe veins. So normal hilar shadow in X-ray is produced by pulmonary artery, bronchus and upper lobe veins. True about chest ray is all except left dome is higher is false, right dome is higher. Left hilum is higher is true. Uh, all fissures are clearly seen on lateral film. Structure forming the right border of heart are superior vena cava, inferior vena cava, and right atrium. Right heart border is formed by all except left atrium. So right heart border is formed by superior vena cava and right atrium. It is also formed by inferior vena cava. Right border of the heart in chest X-ray is formed by superior vena cava, right atrium. Left border of the heart in chest X-ray is formed by pulmonary artery and arch of aorta. Left border of heart on chest X-ray is formed by aortic arch and left ventricle. Base of heart is formed by both right atrium and left atrium. In X-ray, right border of mediastinum is formed by all except right ventricle. So right border of mediastinum is formed by superior vena cava, right atrium, and right brachiocephalic vein. Right side of mediastinum shadow is not formed by right ventricle, it is formed by superior vena cava, right innominates, and right atrium. What is true about chest X-ray? 40% lung tissue seen obscured by bony structure and mediastinum. Right dome is higher than left dome and right dome pushed up by the lever. All are true about thymus swelling except shift of trachea on X-ray. So what is true about thymus swelling? Widening of mediastinum on X-ray, sharp border with sail-like appearance, and steroid administration reduces the size of swelling. Tracheal bifurcation on X-ray corresponds to T4-T5 or sternal angle. Perihilar fluffy opacities on chest X-ray is seen in pulmonary edema. All are true about curly B lines except it runs from hilar area to peripheral area is false. What is true is it is horizontal and due to thickening of septa and due to pulmonary venous hypertension. Curly B lines are found in interstitial edema, pulmonary venous congestion, and mitral stenosis. It is not found in pericardial effusion. Curly B line are seen in mitral stenosis, interstitial edema, and lymphangitis carcinomatosis. Air bronchogram may be seen in the following except lung collapse. So air bronchogram can be seen in consolidation of lung, bronchoalveolar carcinoma, and normal variant. Silhouetting of left border of heart, Silhout sign positive on chest radiograph indicates which pathology? Lingular pathology. Consolidation of which portion of the lung is likely to obliterate the aortic knuckle on X-ray chest? Left upper lobe, posterior part. A triangular opacity with clear border base toward midline and obliterating right heart border on a chest radiograph suggests that the pathology is likely to be in right middle lobe. Bulging fissure in the lung is seen in Klebsiella pneumonia.